Hi, everyone. Thank you for joining us here today to celebrate Filipino-American History Month and to recognize the incredible contributions that Filipino Americans have made in healthcare and health policy. Their dedication, resilience, and compassion have improved the health of our nation and have enriched our communities with cultural diversity and understanding. We at APIAHF are so proud of our friendships and partnerships with incredible leaders and organizations represented here today. It is my honor to introduce the president of the Philippine Nurses Association of America, Dr. Marlon Saria. Dr. Saria and PNAA have been an essential voice for nursing organizations in the Asian American and Native Hawaiian Pacific Islander communities at the national level. They have advocated for equal opportunities for Filipino American leaders and additional resources for our communities, including better supports and care and toward well-being. Dr. Saria, thank you so much for joining us today.
Thank you. Thank you, Joyce. Good afternoon, everyone, and happy Filipino-American History Month. On behalf of the Philippine Nurses Association of America, I am honored to welcome you all to today's panel discussion on a topic that is both timely and essential: the impact and influence of Filipino Americans working in health policy at the national level. As we gather here this afternoon, we celebrate not only the rich heritage of our community, but also the profound contributions that Filipino American healthcare professionals have made to the field of health policy. I wanted to share with you my mantra as president of PNAA: I to PNAA, impact and influence. It encapsulates the significant role of Filipino American nurses and now talking about Filipino American healthcare professionals play in shaping policies that affect Asian American, Native Hawaiian, Pacific Islander communities across the nation. And here we are at this important panel discussion doing just that, extending our influence and making a significant impact. We are privileged to have with us a panel of esteemed professionals who have navigated these paths and who are eager to share their experiences. They will discuss their current roles, the challenges they've faced, and the successes they've achieved in influencing health policies that resonate with our communities. For those of you who aspire to break into the world of policy development, you are in the right place. Our panelists will provide invaluable insights and practical advice on how to navigate this complex landscape. Their stories serve as a testament to the fact that with dedication, passion, and the right guidance, you too can make a difference. As we explore the impact of our work, let us remember that our voices matter. We have the power to influence policies that directly affect our communities, ensuring that they receive the healthcare they deserve. Together, we can advocate for equity, access, and improve health outcomes for all. I encourage you all to engage actively in today's discussion, ask questions, and share your own experiences. Let us harness our collective knowledge and passion to inspire the next generation of leaders in health policy. Thank you all for being here, and let's make this a fruitful and enlightening session. Maraming salamat po. Happy Filipino-American History Month.
Thank you so much, Dr. Saria. Now it is my pleasure to introduce our panel. Paulo Pontemayor is the Senior Director of Government Relations at Catholic Health Association of the United States and Chair Emeritus at the Partnership for Medicaid. Sherie Lou Santos is Chief of Policy and Government Affairs at the Association of Maternal and Child Health Programs. Ben Melano is Deputy Director of Federal Affairs at the American Academy of Child and Adolescent Psychiatry. And Bryce Mendez is a specialist in defense healthcare policy at the Congressional Research Service. Paulo, turning it over to you to kick us off.
Great. Thanks, Joyce, and thank you, Dr. Saria, for being part of this panel. We really are thankful for the Asian Pacific Islander American Health Forum and the Philippine Nurses Association of America for being really great thought partners, as well as for giving us the resources to host this webinar. As Joyce mentioned, this is a timely webinar for many of us working in national health policy. And I think that because I'm the oldest, so I guess I'm the kuya of the bunch, I will get us started and maybe do some quick introductions from our very esteemed panelists. As Joyce mentioned, I'm the Senior Director for Government Relations at the Catholic Health Association. We are the membership organization of more than 2,200 Catholic hospitals, long-term care facilities, continuing care, and any other system that was founded by Catholic sisters, priests, and lay people in all parts of the United States. And so it's a great opportunity, again, to be able to carry policy as part of this organization, but also to bring kind of both my Filipino-American identity and really the value that Filipino Americans can play in national health policy. And so I'll turn it over to Sherie to do the next introduction.
Thanks, Paulo, and thanks for having me. And thank you all for joining us today. My name is Sherie Lou Santos, and as Joyce mentioned, I'm the current Chief of Policy and Government Affairs at the Association of Maternal and Child Health Programs, or AMCHEF for short. As the name in our organization mentions, we focus on maternal and child health issues, and we kind of define that very broadly to work on all issues under the sun that may positively or negatively impact maternal and child health. But I think maybe what would be more interesting is a little bit of background on me. So I did not start off understanding or wanting to be in the health policy space. I, maybe no surprise to folks, wanted to be a doctor, like maybe many of you. I actually met Bryce in college as a biology major pre-med student. I then realized I did not want to study biology as a full-time thing, so I shifted to social sciences. I graduated undergrad at GW, or the George Washington University, with a psychology major on the pre-med path, a biology minor, and a sociocultural anthropology minor. Still thinking I wanted to pursue that MDA, MPH path. I decided to go MPH first, and I never really left. I fell in love with public health, and I kind of really liked that kind of public health mindset in the health awareness, health education component, but also maternal and child health, which is kind of how I now am at the Association of Maternal and Child Health Programs. But in between, I kind of tripped on my shoelace. Somebody gave me a job in Congress, and I fell in love with health policy. So I'm happy to chat a little bit more about that as we continue our discussion today. So maybe I will pass it to Ben.
Thanks, Sherie. I'm Ben Melano. I'm Deputy Director of Federal Affairs at the American Academy of Child Health and Psychiatry. So we represent, or I represent, child health and psychiatrists, and those are, MDs and DOs who really work a lot with children, particularly on children's mental health issues. Similar to Sherie, and I think every Filipinos out there, our parents, my mom, really, pushed me to go to medical school, think of going to medical school. I went to college thinking I wanted to go into health allied field, and kind of started with a path to go into pharmacy. Funnily enough, my mom and my aunt are both nurses, a typical Filipino a healthcare job. But really, I knew that it wasn't for me. And so I fell in love with political science. I studied political science, graduated from California Lutheran University in Thousand Oaks, a very small school, and then actually interned, originally from Hawaii, so interned with Senator Hirono's office around my junior year into senior year of college, fell in love with it, and really, wanted to come back to DC and find a way to do that. I had no idea I would do health policy at all. For that matter, but I've been doing it for quite some time, and I think went into mental health, particularly as we were into COVID and coming out of COVID. Really wanted to ensure, I think, that as more policies are moving out there on mental health issues, we wanted to make sure that the next generation have the needs that they have. So I'll pass it on to Bryce.
Hi, everyone. Nice to meet you all, and thank you to our host for hosting this really great opportunity to chat with folks from different experiences and different professional backgrounds. So wonderful to join the ranks of such excellent Filipino Americans here in the health policy field. My name is Bryce Mendez. I work at the Congressional Research Service, or CRS. CRS is Congress's policy think tank, and I'm a policy analyst there. I cover military healthcare. And this was not originally the path that I thought I was heading into. like many of my colleagues here, I was pre-med for about a semester in college. And after finishing up the baby bio or your initial biology class, that's when I quickly learned that maybe medicine or medical school wasn't for me. And so after taking a few public health classes, and in undergrad, I majored in political science. And so after taking a few public health classes, learned more about the public policy tracks in that degree field, and then fell into health policy. And so that's kind of in a nutshell how I got into this field. My initial career path took me into military and veterans health policy, and it's ever since it's grown on me. So looking forward to the conversation and happy to share about my experiences over the years. Thanks.
Thanks, Bryce. So I think a common theme that we all have, and I'll share a little bit of my story. So I too, no surprise, I think was also thinking about a career in medicine or nursing. As an undergraduate, I was the declared medical technology major at the University of Washington. And I think after my first chemistry class, I had to kind of come up with a new way forward. And I had to talk to my parents and be real with them, saying, because I also had taken my first political science class at that time, that would you like a very mediocre child in college who's doing a medicine path? Or would you like someone who's very passionate about political science and really seeing where that could go? And I think that was my very first success as a lobbyist. I think being able to convince my parents that maybe the path in medicine or nursing was not for me. So very quickly, to reiterate, by a show of hands, how many of us actually thought we were going to go into medicine, nursing, or a health profession, like a clinician path when we started this journey? So show of hands. So all of us. And I think that that is a really a good way to kind of frame this conversation. I think for many young Filipino Americans going to college, thinking about their career paths or becoming interns, like many of us here in Washington, D.C., where we all met and worked together, there is that moment where you kind of have to pivot to thinking about health policy. And I think I'll throw this next question out, whoever wants to answer it first. What was that moment that caused you to rethink your career path and to see that health policy was a good place to, put your career and begin your career and actually blossom? So anyone can start first.
I'm happy to start, Paulo, and maybe I think I might have had a slightly different path to get to health policy from the beginning. So I actually wanted to be as far away from health policy or any policy and politics as humanly possible. I did live in DC for 20 years. I mentioned I went to the George Washington University, which is in the heart of DC. And for many, many years, I did not want anything to do with policy. I tried to go every which way around a health-related career or job that was not nursing or pharmacist or a doctor, solely because I was, to be honest, too lazy to go that path. Like I did not want to work that hard. So I tried everything else under the sun. And in my years as a public health professional, I did a lot of on the ground work. So being out in the community, having a lot of conversations, doing a lot of, hands-on health education, whether it's one-on-one or in a group scenario. And I realized when I was doing a lot of this public health work that there was a disconnect between the work that I was doing or the funding for the work that I was doing or lack thereof, and the policies that existed to provide an infrastructure for public health education, public health communication, education in this space. So I actually kind of went around it backwards, like still thinking I don't want to have anything to do with policy. I decided I want to learn about health policy so I can maybe changed some minds about how important public health is, how important it is to fund certain preventive health activities and initiatives. So I went a fellowship route around mid-career to Congress, and that's where I mentioned I tripped on my shoelace and I landed a job in Capitol Hill. I actually ended up being a health fellow for the Senate Health Committee. So that's the Health, Education, Labor, and Pensions Committee for then ranking member Senator Patty Murray. And it was one of the most life-changing experiences I've ever had. I did come into it wanting to kind of have it as a temporary 1 year, let me learn, let me try to spread how amazing public health is, and then I'll take all this information back into the community, back into the public health space, so that there can be that, at least for me, connective conversation between public health initiatives and policy and why there is that disconnect. I found about maybe halfway through my fellowship opportunity that one, I actually like health policy, and I don't know why it took me this long to figure that out. Two, I'm relatively decent at it, so maybe I should continue down this path of, trying to hone in my own skills, for this health policy realm. Something that I really loved about it is because I came from this mindset of previously wanting to have been a direct care provider. I mentioned I wanted to be a doctor. I was at one point an EMT, so I kind of like had that medical care provider mindset or exposure to be able to have conversations with organizations that are really working in this space and can get really nitty gritty with the science. I previously worked in academia, so I can also talk to the academicians, and I can package those all together and translate that into policy that hopefully makes more sense and gets to the point of the issue of why I ended up in Congress in the first place. I wanted to figure out why there was that disconnect between public health initiatives and policy. So that was kind of my come to Jesus moment, if you will, of, really feeling like I could make an impact and a difference and, have this passion for a career path that I never knew existed because I was initially not open to trying it.
Thanks, Sherie. Ben?
Yeah, I think I'll start with this. Immigrated to Hawaii from the Philippines around 11 or 12. I didn't even know, what health policy was for that matter. All I knew was that, coming from from that neighborhood, being basically brought up in the Philippines, mostly my formative years, and then moving to Hawaii, kind of learning a little bit more about it. I knew there was something in me that I wanted to be some sort of like somewhere in the healthcare field. I think everyone else volunteered at a hospital while I was in high school, kind of did all of that stuff, did everything. And then when I got to college, declared biochem as a major, and then I got my first C in like intro to chem, and I knew that wasn't for me. I was like trying, it was so abstract in my mind, like how do atoms work? And so I wasn't understanding that. And so to kind of start a little bit here, I changed my major to political science. Similar to you, I think, Paulo, I sat down with my mom. I had to talk to her what political science was, because I think, being an immigrant, it was like, what are you talking about? Like, what is this weird concept out there that I don't understand, because it's not medicine, it's not biology, it's not chemistry. And so I think that's when, for me anyway, when I pivoted to health policy, was kind of remembering, mostly from my childhood, like the understanding, or even like key minority health issues, like on social determinants of health, or even for me anyway, as I moved into mental health, within the Filipino community, or within my family anyway, mental health is not something that we talk about a lot. And so I wanted to try to change that narrative within that aspect of it. And so I started with health policy, particularly working, I will say, within the Hispanic space. That's where I started my work on that. and that was on minority health issues. I think, there's similarities between, Hispanics and Filipinos, right? For a long time. And that's a lot with our diet and everything else in between. And that's, on that aspect of it. And then I think from that, adding on to the fact that I grew up in the Philippines, kind of understanding that, and then trying to understand what can I do with health policy. And I remember when I was an intern, I attended a lot of briefings, and health policy was not something I thought of doing. I thought it was so difficult. It's a different animal. And just because everyone has all of these acronyms, everyone needs to understand Medicare, Medicaid, everything in between. But I think for me, what really made me want to do health policy is really just thinking of our population itself, like making us understand, or making sure that the policies out there and the information out there that's being put out really also helps address as well, the growing Filipino population out there. And I think, for me, and I think all of us as lobbyists, we represent organizations, and I think we've all heard the term, if you're not at the table, you're on the menu. And I think us having, being able to sit there and talk about these issues is, I think I just like to talk, and I like to make sure that, whatever it is I'm talking about is included in anything. So I think that's what I got into health policy. And I think the other part of that too is really just, again, it's all about that minority health issues that a lot of people tend to oversee, so overlook.
Thanks, Ben.
Yeah, I think my experience has kind of a mix of what Sherie Lou and Ben had mentioned. So I would say there had been a couple turning points in my career where health policy became the it thing for me. And so similar to Sherie Lou's experience, I too was a EMT at one point during college, and just kind of being on the ground, like not just having that clinical role, but in the pre-hospital setting where it's kind of just the wild, wild west sometimes when you're operating or providing healthcare in a non-traditional setting, right? And so you're out in communities, you're treating patients individually, but also you're interacting with healthcare organizations, healthcare systems, healthcare providers, hospitals, clinics, dialysis centers, ambulances, the pre-hospital healthcare setting, different health payers, and kind of going through those experiences, you tend to realize, hey, you know what would be nice if someone would change this policy so that we can operate better on the ground, or it would be nice if someone would pay, pay or reimburse, this for this service at a rate that meets all of the costs associated with it. And so kind of going through those types of experiences, that's when you start to think, you know what, there's probably a bigger picture here that might be interesting, because if you can point out some of those challenges that are on the ground and think through and creatively develop some options or some solutions to those challenges, maybe health policy might be your thing. So I would say that's kind of that first turning point there. And then I think the second part was after I finished grad school, I have a master's in public health, also from the George Washington University. This was the 2010 timeframe, so the economic outlook wasn't looking too good at that point in time, doing the job hunt. And I actually got an opportunity to participate in the Federal Career Internship Program, which I believe now a lot of federal agencies call it the Pathways Program for new graduates or graduate recruits. And so I was recruited into the Department of Defense's Federal Career Internship Program, learning about the military health system and thinking from an organizational perspective, how to manage the system and how to develop the right policies to administer that healthcare system, one of the largest federal health systems in the United States. So I would say those two experiences really helped solidify not only my interests, but also to kind of highlight a pathway to grow and develop more into this health policy setting rather than the clinical setting.
Great, thanks, Bryce. I think that a lot of similarities between what we've all said, that it really has been kind of this process of discovery, of figuring out what health policy means based on kind of the different adventures we've had in our careers. The way that I got into health policy is the summer after my freshman year, volunteered with HIV/AIDS advocacy and support organization back in Guam, where I'm from. And that's where it opened my eyes that healthcare and health is the sum of, just beyond a doctor's office or an encounter with a health professional, that there is really a whole spectrum of ways that we interact with healthcare. Healthcare, I think we've been told in many of our briefings or things that we have to go to, is 1/6 of the US economy. So there is something in it for everyone. And I think that that was kind of my entryway into it. And similar to Sherie and Ben, I also had internships on Capitol Hill that morphed into career positions. And so I would say that if Ben had trouble figuring out how atoms worked, I think we were still trying to figure out how Congress works. And I think that that in itself is, an adventure in itself. And so I'm so pleased to hear that despite kind of all the different ways that we've interacted with, this topic, we still all found our ways to do it at the national level. And so the next question that I have, and I think this is very useful for a lot of our callers on this webinar, is what advice would you give to students or young professionals who really would like to get into health policy? I think we said that there are so many different pathways to it, but what are the top 2 or 3 things that you would tell someone interested in this field, knowing that we all have different paths, but maybe some tips for the people who come after us? So anyone can start if they'd like.
I can start again.
Okay.
So I would say the top 2 things that I would share as pieces of advice are really build your network. You never know when a job opportunity can come your way, when a network, a colleague can lead to X, Y, or Z, both on the personal side or professional side. So I would say really build your network, and on the other end of that, never let any bridges burn. The health policy space is, or the policy space, but particularly the health policy space is a very, very small space. So, maintaining those positive interactions is always extremely helpful. And then my second piece of advice is very, very much because it was a learning opportunity for me, right? Like, don't let yourself pigeonhole yourself into one career path or another. Even within health policy, when I went into health policy, I thought I only wanted to work on public health initiatives. So things that the CDC covers, or things that the Health Resources Services Administration cover. Anything that, I was really learning and very excited about within my Master's of Public Health program. I thought, like, okay, this is the lane that I want to be in. I don't want to be anywhere else. I actually was given the FDA portfolio, and at first I did not connect the dots. I could not figure out how the Food and Drug Administration had anything to do with public health. And I didn't, like Ben was mentioning, I didn't understand the language they spoke. I didn't understand how these pieces connected. And then once you get into payment models, and talking about coverage, I was like, okay, I'm just completely lost. I have no idea what this conversation is about. But I let myself, I gave myself a little bit of grace and time for that learning opportunity. I actually found that I love FDA policy. And now I'm currently in a space meshing all of those things together, really looking at the public health component, figuring out what are medical devices, what are medications, et cetera, that can be helpful to maternal and child health populations. And then on the coverage piece, how do we pay for this? How can this become more accessible to populations across the country or across the globe, if it's that widespread? So 2 different things. Build a very, very strong network around you. Fun fact, Bryce actually helped me get off my feet when I was lost in Congress. Like Paulo mentioned, figuring out okay, I'm trying to figure out Congress. let me call Bryce, who happened to already be in the Congressional Research Service. And I was like, Bryce is literally my go-to resource here in Congress. And then second, don't let yourself pigeonhole yourself into one path or another, because you never know what door can open that you may fall in love with.
Great, thanks.
I will ditto Sherie Lou's first one, which is don't pigeonhole yourself. Two things, to me, being adaptable and embracing lifelong learning is one. And early in your career, I started a little bit in healthcare and then moved into higher education space, and then went back to healthcare because I knew I missed it and I loved it. And so, but really being open to unexpected opportunities, even pivoting really to new fields, would be great. Building mentors and peers, having them around you is invaluable. The other thing that I will say is you are your own advocate, and that's true in your profession, but also in really talking to me anyway, talking to your parents about making them understand why you want to go into health policy or policy in general, and not following the steps or the want or whatever it is that they want you to do, right? Going into health policy. And I think, it takes a lot, I will say, to tell your parents, to tell your moms, tell your dad, or even your grandparents, to make them understand like why health policy is important. And it's not just about being going into healthcare. My dentist, I will say this, my dentist, who I've seen for years and years and years, she's Filipino. And we were talking about being Filipino the other day, and she goes, "Oh, did your parents ever tell you to be a dentist?" I was like, "Well, they told me to go into medical school." And she said, "Well, sometimes it's not really worth it, because at the end of the day, like, you just spend time and time in school." But she and I really had a good conversation about, I'm still able to affect healthcare in a different way outside of that. So I think, you are your own advocate in regards to really talking to your parents as well. I think growing up in a Filipino household, very strict parents, and everyone, there's this rigid pathway that you have to go through, and being able to step up and say, like, this is really not what I want to do. And to Paulo's point, being able for him to talk to his parents and say, you want an A student, or do you want someone who's not gonna do so well? So I think, being an advocate, and I will say to Sherie Lou's point, just being open to ideas.
Thanks, Ben.
Yeah, I would echo both Ben and Sherie Lou's advice here. I mean, those were exactly the advice that was exactly the advice I needed 2 decades ago as I was trying to navigate what the heck I was doing in my life, and then eventually settled into the health policy space. I would also offer two items here. One is politics, right? So even though you're in the policy space, no matter where you're working, no matter what type of organization you're working for or in, politics is always a factor, and it can play a role in your ability to do health policy work. And so whether you're in a government agency, whether at the federal, state, local level, whether you're in a nonprofit organization, advocacy organization, or even the private sector, politics is always in play. And so understanding the dynamics in that organization and understanding how you can use that to either advance your policy objectives or advance your career goals in health policy is something to keep mind of, and then also to understand how to utilize that as a strength for yourself. The second item I'd like to bring up is passion, right? So as cliche as it sounds, follow your passion, right? So if you don't know what your passion is, take the time and invest the time to figure out if this is a career path for you. And perhaps, some of those experiences, like trying it out, try working at an organization that you think you might be interested in. You'll then learn whether you're in it or you're not in it, or if it's something you totally hate. You're not going to know until you experience it. So figuring out your passion is absolutely important and critical to developing a positive career, because you kind of don't want to get stuck in that for a long time and then you'll just hate your job the whole time. You want to figure out what makes you wake up and go to work and enjoy the work that you do. So those are the 2 points that I'd like to hit. Thanks.
Yeah, and I think just to echo that, a lot of us are part of very mission-driven organizations or actually work in public service, which I think goes to show that there are different ways to do health policy. And as Bryce mentioned, you don't have to do this just in the public sector. You can also do this in the private sector, or for some of us on this call, the association space. And so that's, I think, my advice. Like, don't think that there is one pathway to doing health policy. Like, you don't have to do a Capitol Hill internship. You don't have to, decide that you would like to get your master's in public health, which, plug, I think 3 of us have our master's in public health, and Ben, I think, also has master's in public training. So think about grad school as part of your plan to get you where you're at. And also, just to echo, like, be very open to a lot of the experiences. Healthcare is so varied. When I first started here, and they gave me the healthcare portfolio on Capitol Hill, I did not know the difference between Medicare or Medicaid. And now all I talk about is Medicare and Medicaid, among other things. And so you never know where your adventures will be. And so I think now that we kind of are at the tail end of our call, I'd just like to ask our panelists if this is a very small space for Filipino Americans. There's not the playbook for us being able to do this. So would you all be open to sharing your emails or your LinkedIn with our participants? Because I know many of them are maybe thinking about that career pivot, or also thinking about follow-up questions for all of you. So if you'd like and are willing, please share that in the chat right now. And I'll just go ahead and thank the Asian Pacific Islander American Health Forum for hosting us, the Philippine Nurses Association of America for being a thought partner in this, and want to say that, maybe in the future, maybe some of us will go back to nursing school. Who knows? We have a very long trajectory thinking about healthcare. Any closing remarks from everyone else before we wrap up? Yeah. Okay. Well, thanks again. This webinar will be recorded and will be available for our colleagues who could not make it to this very timely conversation for Filipino-American History Month. I think that we came together at the very last second to offer an offering for Filipino-American History Month, and I'm so grateful to all my co-panelists for being part of the national health policy space and being colleagues that I can email and call, especially when I find myself the only Filipino American in a room. So great. I'll turn it over back to Reed, our administrator for this call. And thank you again, all my panelists, and we will be in touch.